If your loved one has recently been discharged from the hospital, it can be challenging to know where to start. This roadmap provides an overview of what to expect in the days and weeks following discharge, including tips for managing medication, diet, exercise, and more. In this video, I will show you some tips to help make the transition smoother and get you back on your feet as soon as possible. The main goal is to regain total functional capabilities. Please understand that hospitalizations affect all 5 domains of your life. Let us know briefly. Each human has a body, mind, intellect, and spiritual and social domains. After hospitalization, our bodies are stressed to the max, we are emotionally drained, and we have difficulty in thinking clearly. Our faith is challenged. Socially, it strains our relationships with our family and friends. There is always a change in patient conditions and needs. The inadequate handoff between healthcare providers is the main reason for poor outcomes. This time is incredibly challenging for seniors. They have decreased physical capabilities and need help with communication, transportation, meal preparation, medication management, and activities of daily living to maintain at home. Our healthcare system is not designed to address these needs, and people have recently started paying attention. About 15% of these patients are readmitted to hospitals, costing about $15 to $20 billion per year. The readmissions increase the chance of complications and death. Proper communication and care coordination is paramount to reducing readmissions. The clinical factors that increase admission and readmission risk are high-risk medications, polypharmacy, and multiple chronic diseases. The low literacy, prior hospitalization, poverty, lack of emotional support, transportation, and discharge against medical advice increases the risks. The following are the most common reasons for complications after hospitalization. Medication adverse events. These are more common than what is reported. Medication non-compliance by the patient, fall injuries, lack of timely follow-up care, failure to identify post-acute care needs, need for adequate nutrition, lack of transportation to access care, infection. After hospitalization, following up with your primary care physician is essential to ensure a smooth transition and continued treatment. Here are some steps you can take after hospitalization. Follow up with your PCP. Your PCP can help you understand the results of any tests performed during your hospitalization and continue any necessary treatment plans. Review your discharge instructions. Ensure you understand the instructions you were given at discharge and follow them carefully. You must be clear about medication, dietary changes, or activity restrictions. Request copies of your medical records. Obtaining a copy of your medical records can be helpful for future reference and any other healthcare providers involved in your care. Schedule follow-up appointments. Schedule appointments promptly if you were referred to a specialist or need additional testing. Keep track of symptoms. Keep a record of any symptoms you experience after your hospitalization, such as pain, swelling, or changes in your condition. Make lifestyle changes. If your hospitalization was related to a chronic condition, such as heart disease or diabetes, consider changing your lifestyle to manage your condition better and prevent future hospitalizations. Seek support. If your hospitalization was related to a mental health issue, consider seeking support from friends, family, or a mental health professional. Get rest and be patient. Recovery after a hospitalization can take time, so getting adequate rest and patience is essential as your body heals. Overall, it's essential to follow up with your healthcare providers and take steps to continue your treatment and recovery after a hospitalization. At Shield Medical Group, we have a state-to-the-art transition of care program. We track all the patients admitted to the hospital. Our health coach will call you and set up a follow-up as soon as possible. You will receive reminder calls from your health coach to help you navigate this difficult period. We will ensure that you know your medications. Your nutritional needs are met. We help you to get proper transportation. We will work with other healthcare providers. Your speedy recovery is our goal.